Hello, my people. We are still winding up our topic about vomiting, and today will be the last part of this discussion, whereby we will be talking about the complications or what happens if vomiting is not dealt with or treated at the right time. Before we continue, guys, I always appreciate your support, uh, your subscriptions, your likes, your comments, and for those who have not subscribed, it's a new year, and we should start this new year on a high gear or on a high note, and try to push this channel further because it's helping us all as a community. So let's continue sharing, let's continue subscribing, and I know it's going to get bigger and bigger. So what are the complications of vomiting, or the complication associated with vomiting? Vomiting may lead to severe complications, especially if recurring over a period of time. Recurring means that it goes away and it comes back. It goes away and it comes back. So if it's recurring over a period of days, it can cause serious complications. And some of these complications include the following. Number one, aspiration of the vomiters into the airway or the air passages and lungs, or what we call aspiration. Let me repeat this point. Some of these complications include aspiration of vomiters into the air passage and lungs. Aspiration is possible since air passages are protected by epiglottis, which closes when fluid tries to enter. So when fluid tries to enter the airway or the air passages, the epiglottis closes down to prevent the fluid from entering, especially, like for example, when the child is lying facing upwards or facing the roof and the child vomits. It's so easy for the vomiters to enter the air passages and into the lungs. So if the epiglottis doesn't close down, definitely the fluid will enter, or the vomiters will enter the lungs and will cause serious complications like aspiration pneumonia. So aspiration is possible since passages are protected by epiglottis, which closes when fluid tries to enter. Any little amount inhaled fluid, any little amount of fluid inhaled leads to a cough response. And I know this has happened to every one of us. When anything tries to enter the airway or into the lungs, a cough reflex is initiated that forces that substance that was entering the air passages to come out. If it was like for example food, a piece of small food, if you cough, it might come out even through the nostrils. So inhaled fluid leads to a cough response, which expels the fluid effectively without causing damage to the lungs. So when you cough, the inhaled fluid comes out without causing any damage to the lungs. However, risk of aspirating contents of vomiters becomes high when this protective cough reflex is weakened. For example, if this reflex is weakened, or abolished, for example, in unconscious patients or patients under local anesthesia or babies or elderly. Aspiration leads to choking, asphyxiation, and aspiration pneumonia. Those are the conditions that can become about with aspiration. A point to note, aspiration pneumonia is an infection and inflammation of lungs due to aspiration of any fluid or vomiters into the lungs, and it can be life-threatening and may lead to respiratory failure if not detected and treated early. Let me repeat this point, that aspiration pneumonia is an infection and inflammation of lungs due to aspiration of any fluid or vomiters into the lungs, and it can be life-threatening and may lead to respiratory failure if not detected and treated earlier. The second complication of vomiting is what we call electrolyte and water loss. Electrolyte imbalance and water loss. Excess vomiting, especially over a prolonged period of time, leads to excess loss of water and electrolytes from the body. Let me repeat this. Excess vomiting, especially over a prolonged period of time, leads to excess loss of water and electrolytes from the body. Electrolytes such as sodium, potassium, calcium, magnesium, bicarbonates, and chloride ions are essential for normal body functions. Electrolytes such as sodium, potassium, calcium, magnesium, bicarbonates, and chloride ions are essential for normal bodily functions. That means if you lose these electrolytes, the normal body functions will be interfered with, or your body will not function normally. As water is lost during vomiting, the delicate balance of electrolytes is also altered, which can lead to severe complications. As water is lost during vomiting, the delicate balance of electrolytes is also altered or interfered with, which can lead to severe complications. Vomiting makes it difficult to both consume foods and fluids and keep them down. Vomiting makes it difficult to both consume foods and fluids and keep them down. This aggravates the electrolyte depletion and depletion. This aggravates electrolyte depletion and deficiencies, worsening the condition. Vomiting makes it difficult for both to consume foods and fluids and to keep them down. This aggravates the electrolyte depletion and deficiencies, thus worsening the condition. This marks the end of our first video today, and in our next video we will still continue discussing about the complications which come about as a result of vomiting, and we'll also kickstart a new chapter about diarrhea, which so many people have been pushing. They have been telling me to discuss about diarrhea, but my people, we have to be patient with each other, because I can't discuss all the topics you have brought about at the same time. We have to discuss one after the other. So let's be patient with each other. So let's meet in the next video.